Hello, I'm Amanda Walker, and welcome to Inside America, the show that brings you insight and analysis of the biggest issues facing the United States right now. In today's episode, the so-called war on science, layoffs at federal agencies and sweeping cuts to grants across the United States. The Trump administration is accused of a wholesale assault on health research. Scientists say life-saving work is under threat, with some claiming the whole world could now be underprepared for the next health crisis. Coming up, we'll ask what is behind this decision and who's being most affected by it.
I think about how we have gone so far away from science and facts and research on when we know how to care for people.
And we speak to one of the key figures sounding the alarm.
This is a scorched earth policy. Science and mathematics and the health of the public is getting hurting along the way.
So, as with most of what's happened in the first few months of Donald Trump's second presidency, actions affecting scientific research have been handled with the now familiar shock and awe strategy. Here's a reminder of what's been going on.
Executive orders for your attention today, sir. The first relates to gain-of-function research.
What the Democrats call the war on science is being waged on many fronts. From President Trump's choice of a vaccine skeptic as health secretary.
I think there may be a presumption that because COVID has become less deadly in our country, that it's because of the vaccines. There's no proof of that. There's no vaccine that is, safe and effective.
Those are big words.
To his crackdown on international scientific collaboration.
What is this one? Withdrawing from the World Health Organization, sir.
Ooh, that's a big one. I withdrew from the corrupt World Health Organization where we were paying $470 million.
Firing of scientists and gutting of funding has left the US research community shell-shocked, all done on the populist money-saving platform.
Waste, fraud, and abuse, of which there's tremendous amount.
The war on diversity, equity, and inclusion is also at play here. A study by GrantWatch found that some of the most commonly used words in terminated NIH grants were HIV, minority, COVID, women, and black. The nature of the specific areas that are being slashed is raising alarm. According to a Senate study, nearly $700 million in NIH funding was cut to urgent public health research, with major setbacks in women and children's health, as well as cancer research.
So that's what has been happening. Let's look at the impact it's all going to have. Dr. Georges Benjamin is one of the top public health officials in the US. His organization, the American Public Health Association, is currently taking legal action against Trump's measures on science. I asked him how they could affect America's scientific superpower status.
These cuts that we had are basically taking apart everything we've done since the Second World War and really destroying the infrastructure. This doesn't happen overnight. Anyone who's done a high school biology project knows that many of these projects can go for weeks and months. And once you interrupt them, they're hard to reproduce.
They say this is about cutting waste, fraud, and abuse across the Department of Health and Human Services. What are they referring to there?
Quite frankly, that's a false statement. What they're really trying to do is reduce the size of government. That has been a long time goal of conservatives, is to reduce the size of government. And the problem is not that they want to reduce costs. Everybody wants to be responsible. But this is not about waste, fraud, and abuse. This is about simply cutting anything. And the problem is the way they're doing it is they're destroying anything in their path. This is a scorched earth policy around all cuts to everything in our country. And science and mathematics and the health of the public is getting hurting along the way.
Who's going to feel these cuts the most?
Every person in our country will be hurt by these. And the other challenge is the rest of the world is going to suffer too. Of course, the underserved and low-income individuals are always disproportionately impacted.
And there seems to be a target, doesn't there, of diversity, equity and inclusion grants and research, DEI, the war on that. So who's going to suffer there?
You know, one of the things that this administration is very good at is trying to create a bad guy. And the bad guy is cover for them doing these broader cuts. So one of those areas is diversity, equity, and inclusion, which, 5 months ago was something that everyone in the whole world championed. But they have now demonized it, and they're using that as cover for their broader cuts to everything. And of course, science is getting caught up in that process.
So you recently said that Robert F. Kennedy Jr., Health Secretary, very controversial pick at the time, should resign or be fired. Why?
We were opposed to him, and when we, not only me personally, but my organization, American Public Health Association, because he was a lawyer, he didn't have any health background, of any meaningful health background. He was anti-vaccine. He says he's for science, but everything he's done in his whole life has been anti-science. He has been someone who has never run a very complex organization. And the Department of Human Services is an over $2 trillion, very complex organization. And of course, now that he's been in office, he has laid back and he's allowed a measles outbreak to rage across our nation. He has given misinformation that, in my view, as a physician, has resulted in children being terribly, terribly damaged from taking vitamin A, which is a toxin for young people. He has allowed for the dismantling of the basic public health infrastructures in our country so that I can promise you that the water is going to be safe to drink, that you can go into a restaurant and eat the food safely. I can't promise you that anymore because of what he's done already in just a few weeks that he's been in the office. He should be fired.
When you look at Donald Trump's first term, Republicans did push back against science cuts. This should be a non-partisan issue, right? But clearly it's not in this second term. What has changed?
There's kind of a public apathy that's going on. Now, the Republicans, as well as the Democrats, are complaining, privately behind the scenes. Democrats more openly than the Republicans, because the cuts that are occurring to the scientific institutions all over the country. So in the states that were more likely to vote for President Trump, like Mississippi and Alabama and Tennessee, they have academic centers too who have large numbers of research grants from the federal government, and they have stopped those grants. And by the way, those were not just diversity, equity, and inclusion grants. Those were grants for maternal child health. Those were grants for vaccine research. Those were grants for environmental health. So they've cut all grants going out the door under the guise of going only after diversity, equity, and inclusion.
So why aren't Republicans speaking up about this, if this is just a broad issue that affects everybody?
Well, I think right now they're afraid. And I think they're, afraid of Trump because they say they'll primary them, meaning that they'll go after their political careers. And my problem is I'm about principle. I personally believe that they should stand up for principle. And I'm hoping that they will suddenly wake up one morning and realize that they're at as much risk and their constituents are at much risk as anybody else.
So there has been some discussion about private donors, billionaires, foundations plugging this gap. What's your take on that?
There's not enough private money in the world to fill this gap that they're creating. There just isn't enough money out there. There will be some bridge dollars. They will try to keep some of these small organizations going that are about to die, that are important. But there is not enough money in the whole world to in the private hands to fill this gap. And I think the challenge we have is that we want the federal government to be invested. We want this to be done in an organized manner where we have oversight and accountability. And of course, philanthropy is there, but they're usually there for a short period of time to do wonderful things, to get innovative ideas, but they're not going to replace government.
Can the science infrastructure, that status post-World War II that we talked about, can it withstand 4 years of Donald Trump?
I think 4 years of Donald Trump are going to cause enormous destruction in our scientific enterprise in this country. We will then begin to lose some of our best minds leaving the United States and going to other countries. And of course, other bright minds around the world used to come into the United States to get their education. And then, of course, they went back to their nations to do their work. And so, you know, you're basically destroying one of the best research enterprises in the whole world. And for what? To make some other people rich? Makes no sense.
Dr. Georges Benjamin there, as he pointed out, a lot of the federal cuts target health research that comes under the diversity, equity and inclusion heading. And Black women are among the groups that are likely to suffer most. The US already has the highest maternal death rate among high-income countries. In 2022, the maternal mortality rate for Black women in the US was more than double the national average. It's a crisis fueled by systemic racism, limited access to quality care, and underlying health conditions that disproportionately affect Black mothers. Experts warn that time is running out to close the research gap, as pregnant women have long been excluded from clinical studies, and Black women remain underrepresented not just in the data, but in the healthcare workforce itself. Mothering Justice is an advocacy group fighting for change. We met them when they came to Washington, D.C. to make their voices heard at this crucial moment.
Well, thank you guys all for coming to the 2025 DC Mamas March.
These women are on the front lines of a fight that's about to become a lot harder.
Mothering justice is a force to be reckoned with.
Yes.
This is a call to action over fears that Trump cuts will shatter efforts to reduce the outsized death rate of Black mothers.
These girls that we see coming through our halls are suffering in silence because they don't see the resources and know that they're there.
I think it's more important now than ever to get with our allies and to be strong and be resilient because it takes, 10, 20, 30, 40 years to undo the ramifications of bad policy.
Because this research comes under the DEI banner, government funding will likely end.
When you see these cuts coming thick and fast, what goes through your mind?
Babies. I think about babies. I think about moms. I think about a story we had of a mom of this in Florida that talked about a mom who was turned away when she was having a miscarriage because they didn't know whether or not they would be liable for helping induce an abortion. Just ridiculous things. I think about how we have gone so far away from science and facts and research on when we know how to care for people. We know what it takes to keep moms healthy. We know what it takes to keep families together. But unfortunately, we continue to cut the programs that do this the best.
How hopeful are you that you're going to push through and get the message that you're here in DC with to the Trump administration?
Yeah, I'm not hopeful that the Trump administration will change their course and their values, but I am hopeful that we can seed a groundswell of energy to move Congress to act on behalf of their constituents.
Congress is, of course, Republican-controlled and very much adhered to Trump's agenda. Some representatives are on board, but it's a battle.
Just give us an insight into the climate inside that building behind you when you're trying to fight for an issue like this.
I just think it's not important to them. It's like every day you're dealing with resistance of people who should be wanting to do right for others. You have groups who are running doula programs, helping to give workshops to mothers about healthy pregnancies. I mean, you name it, they're doing it out there. And so with them cutting funding, that means that we're cutting funding to these very organizations and institutions that focus on this issue and help with this issue. And it's quite frankly, it's disgusting, that they're doing this. And it's pushing us back from all of the progress that we've made.
So just one example there of who might suffer without federal investment. The Trump administration is defiantly defending the cuts, which ultimately could affect everyone. Could this be the riskiest political strategy yet for the Trump administration? Well, let's discuss that and more with our panel, Max Kozlov, who is a reporter with the science journal Nature, and Joyce Frieden, who is Washington editor at MedPage today. Thank you both for joining us. So the recent HHS budget hearing, we heard Health Secretary RFK Jr. defending the reasoning behind all these cuts. Let's listen.
Right now, we have 42 divisions that do maternal health, and we're consolidating them. And the mainstream media has portrayed those as cuts, but they're not cuts, they're consolidations. It's ridiculous to have 42 divisions that are all supposed to be doing the same thing.
So Joyce, just reorganizing, this is all about streamlining, he says. Is that true?
Well, part of the problem with that answer is that we don't know whether it's true, because although they keep saying they're going to be one of the most transparent administrations in history, we have no record and no information about how they're making the cuts. And I suspect that because of their Department of Government Efficiency and all the bragging that they're doing about how many cuts that they're making, that what they really want to do is decrease the size of the government and of these programs.
Max, what do you make of that defense? Is this a new era of government efficiency or a thinly veiled White House agenda setting?
I mean, he says consolidation and not cutting, but the reality is that he's doing both. If you look at the National Institutes of Health, the largest biomedical funder in the world, they have cut more than $1 billion of grant funding, and they have prevented more than $2 billion that's appropriated for this year to be released. So when he's saying consolidating, that sounds like a more fancy word, and something that we shouldn't be concerned about, but it's certainly both consolidation and cutting.
And Joyce, you mentioned transparency there. There was a distinct lack of that at times during the hearing. Let's have another quick listen.
Why did you eliminate CDC's Office of Smoking and Health?
I've been advised by my attorneys and not to talk about it.
Have you had an analysis prior to making those decisions, or Mr. Musk making those decisions? And I ask you first, who made those decisions, you or Musk?
I mean, ultimately, we executed the decisions.
I know you executed them, but my question is...
Elon Musk gave us help in figuring out where there was waste, fraud, and abuse in the department.
Well, look, the fire captain also raised this issue about the National Firefighter Cancer Registry. Also something I promised him I'd ask you about. Why was that shut down?
The cancer, I don't know about that.
You don't know about this?
No.
So Joyce, a kind of lack of awareness on certain big issues there, which sometimes raise the question over who's in charge.
Right. I think that's definitely a question. I do remember during Kennedy's confirmation hearings that he seemed uncertain even of things as basic as the difference between the Medicare and Medicaid programs. And it does seem as if a lot of the current action is being driven by DOGE.
And we heard earlier in the show our interview with Dr. Georges Benjamin saying that RFK Jr. should be fired. What do you think the consensus will be, Max, after the hearing?
I mean, certainly if you talk to researchers who are, especially in the infectious disease and public health spaces that have been decimated by some of the cuts and consolidation, I think they would certainly agree. And to your point about DOGE, just to say that the NIH, there were depositions in a court case where top NIH officials testified that they were given spreadsheets of grants to terminate directly from a representative of DOGE. So people had suspected that DOGE was involved here, but this is a scientific agency that's getting its marching orders from a group that has no scientific background to be able to evaluate what NIH should be funding and what they shouldn't. So I certainly think that that is right.
Joyce, I want to pick up on something that the Health Secretary said. I don't think people should be taking medical advice from me. Now, a lot of people were pretty shocked in that moment, but I want you to give me some sort of more historical context of that. He's not a doctor. Is that a shocking thing for a Health Secretary to say?
It is in a way because the HHS Secretary has always been seen as somewhat of a bully pulpit. So previous health secretaries, for example, Donna Shalala, under Bill Clinton's presidency, she did a big campaign for vaccination with McDonald's. And the people in this position, whether or not they have medical degrees, are usually out there urging Americans to do what they see as the right thing health-wise, like vaccination.
Right, which brings in vaccines, Max. Pretty tepid endorsement
Yeah.
during that hearing?
I mean, look, this is the person who's in charge of the FDA, who's in charge of the CDC, who's in charge of the NIH. They, regardless of how he sees himself, people look to the health secretary for advice about their health. It's like saying the president, the US president, who's the commander-in-chief, if they're asked a question about the army or the military, oh, it's like, why are you taking advice from me? Well, this is the person who's in charge of the very department that is responsible for promoting vaccination and for looking after the health of Americans.
Joyce, with that in mind, is that a risky political strategy? Because this is very emotive stuff, and it's about people's health and people's lives. So this could ultimately be damaging for the administration if they keep pushing with these cuts into Medicaid, for example?
Oh, absolutely. I think it could be. And especially currently in what we call the red states, where people voted for Trump, but then they might begin to see, oh, my neighbor has been kicked off Medicaid when they should still be on. I think people, once they really begin to feel the effects of these cuts, might begin to question support for Trump. Absolutely.
So if it becomes unpopular, which, you know, there are signs that it already is, what's the thinking behind this? Why are they doing it?
That's a great question. I mean, I think they're getting a mandate to just slash and cut wherever they can. And, you know, the collateral damage is by doing keyword searches for things like HIV, AIDS, vaccine hesitancy. You know, there's a lot of collateral damage if you just cut left and right without actually digging into what you're cutting.
I'm sure you'll recall, Joyce, there was a letter back in April by nearly 2,000 scientists basically raising the alarm and saying that there is a climate of fear in research. From your connections, your contacts, how would you describe the mood in the research community right now?
Oh, it's absolutely depressed. And one of the problems is that people are beginning to self-censor, especially at the university level. I just saw a story where they were beginning to change scholarships to medical school because the scholarships were going to minority populations. And so even though maybe Doge hadn't said anything to them, now they were going to broaden the scholarships because they didn't want the taint of diversity, equity, and inclusion. And so I think people are running scared, and a lot of people like Francis Collins, the former NIH director, is very concerned about brain drain and people wanting to go to other countries.
Max, you're agreeing there. What conversations are you having with people within the community?
Yeah, well, there's a huge culture of fear that's been created. You know, it's been night and day the difference in trying to talk to scientists about the impacts this is having. There are so many folks who aren't doing work that would be considered particularly controversial, but because the Trump administration has shown that they are how they treat dissidents, they are afraid to speak out lest their funding be cut. Universities especially are really worried, and they don't want to kind of stick their head out right now. We did a survey at Nature of scientists, and we found that 75% of researchers were considering leaving the country. So, I mean, that's just a staggering number. And even if it's a fraction of that actually move out, I mean, you're talking about a generational brain drain.
Right, and what impact will that have when you look at other countries? Because there is obviously a big degree of competition involved here. That opens the door for China, for example.
Yes. China's a good example to mention. That's exactly the one where they've been trying to catch up in terms of dollars spent on medical research, publication in medical journals. And the problem is that you can't just, if you stop a trial, you can't just then bring it back up once the money's back. It takes years to get everything set up. So this is just going to reverberate, I think, for a long time.
And we're almost out of time, but just a brief response from you both. How well placed are we when you consider everything that's happening right now for the next health crisis, Max?
I would say we're not very well placed, especially on the topic of pandemic preparedness. The infectious diseases research community has especially been hit by these cuts, and even told to not study anything related to COVID-19 because that's a non-existent pandemic that Americans have moved on from years ago. And so to think about a similar pandemic affecting us right now, we would be caught with our pants down.
Joyce, you worried?
Yeah, yes, I'm very worried. Another issue is public health, which has been woefully underfunded, and we have long stopped tracking various infectious diseases and their incidence, or at least the money for it is going away. And so I'm very worried about the next pandemic.
Joyce, Max, thank you both so much for your insights. So not just funding that's at stake, but how we prepare for the next World Health event. Thanks for watching. Do watch us next time on Inside America.